So our next speaker will be Cardoso, who is going to speak on socioeconomic impacts of COVID-19 suppression measures on Bissau's population. Carlos was previously director of the National Institute for Studies and Research in Guinea-Bissau, INEP, and was also before director of the research department at CODESRIA, the African Research Center for Social Sciences, based in Dakar. And he recently founded CESAC, the Amilcar Cabral Center for Social Studies. He teaches at the Catholic University of Guinea-Bissau and has written many books and articles related to Guinea-Bissau and Africa in history, sociology, and social anthropology. Carlos, it's over to you.
Thank you, Toby. Thank you for inviting me to be part of this conference. I will try to speak in English. I would start saying that the outbreak of the COVID-19 created two, I would say, feelings among the population of Guinea-Bissau. The first feeling was that with COVID-19, the country would disappear, so to say, because of the number of patients, but mainly because the conditions, the health conditions in Guinea-Bissau were very bad. And the second feeling is that, this kind of illness is more for white people and people that are weak, so we will not be concerned about this issue of COVID-19. But with the time, we see that some measures were effectively taken. For instance, the issue of the confinement, closing of borders, banning of public transportations, and also the creation of an interministerial committee. The second feeling, I would say that it reflects the knowledge and the perception of the populations in the face of a pandemic. These two questions, in my opinion, fit in the, I would say, debate over the meaning of the pandemic in Africa, that in its turn connects to the role of social science in unpacking the significance of such a disease. Indeed, when the endemic began to take alarming proportions, many of the people panicked, and I was one of them, and we started hearing apocalyptic speeches that say that we would disappear as a country, and other interpretations about the pandemic. I would say both feelings, the apocalyptic, but also the measures that were taken, we can say that this, and mainly the second, about the perception of the endemic and the knowledge, we would say that these issues brought to the surface that we would be dealing with something that touch directly to the perception and the knowledge of the population. We created, because we were at the beginning some social scientists, because we were aware about the complexity of this issue, we created a group that we called CREC, which means Risk Communication and Community Engagement. And this CREC was part of the High Commission for COVID-19. On the government side, we saw some measures that tried to push the confinement, the limitation of people circulation, closing of borders, and the banning of public transportation. The question that we, since the beginning, put ourselves is what would be the impact of the creation of the institutions at one part, but also what would be the implications on the population of Guinea-Bissau. And putting this question brings us to remember that before COVID-19, we had a country which is very poor. We can say that was part of the continent that was, so to say, had to deal with poverty. We had to do with a country with lack of infrastructure, particularly health infrastructure. And this is specifically in our sub-region. If you take a country like the Gambia, we will see that there is only 2 intensive care beds for every 2 million inhabitants. This is not me saying that. This is a medical research unit, somebody who belongs to this medical research unit. What we also witnessed in such a situation is a shortage of health personnel, 1 doctor for 5,964 people, inequality in social and social cleavage, lack of organizations of the state, an authoritarian political regimes, and on top of all this, we have what we consider a very complex social and cultural country in terms of ethnic population and so on. In such a context, we would say that the social science have an opportunity to prove their relevance socially and in the face of the challenge facing humanity. In some African countries, we see that like in South Africa or Cameroon, we see social scientists creating a group of study, of research that try to bring about the contribution of the social science in combating the coronavirus. But what we would like to underline is that we are not defending here an African, what do you call it, an African exception, but we think that there are some economic, social, and cultural realities that we should take into consideration when we talk about these measures that are restrictive in terms of circulation of people, but also in terms of how people should behave in their own households. We see that the existence of an interministerial commission to combat the new coronavirus and in Guinea-Bissau, we see that this is not sufficient, the creation of such a commission. This commission should have a vision and also coordinating activities that are inclusive in terms of the spirit of this commission. But what we witnessed in Guinea-Bissau is that instead of all that, the focus was on administrative measures that had very limited and sometimes even prejudicial impact. I would say that in Guinea-Bissau, for instance, the social distancing and the confinement promoted the extreme desocialization, what the Germans call Entgesellschaftung of human life. We should not forget that our population are used to body contact. We can see it in the public transportation. What, for instance, struck me when I came back to Guinea-Bissau in the buses, how people sometimes, even women, can come very close to you during the transport. So this is something that I was not no more used when I was in Germany. So it struck me this kind of behavior. So, but according to the data from the Fund Security and Nutrition, we see that there was a very difficult economic situation. 30% of households in Guinea-Bissau were food insecure. And these are the social conditions that will make not only difficult to apply those measures, but applying them, this would make the life of the people more difficult. Then a part of this we will see that there is a structural fragility of the state in those contexts. In fact, we would say that these measures contributed to worsening of the inequalities and their abolition. We see we know some studies of the ECOWAS that also give us information on how the economic conditions were difficult in such part of the country. What are the way forward with all this impact? I would say that we must put ourselves some questions. For instance, what sense does it make to decrease the distancing in a reality where people have other behaviors? What sense is there in confining the infected people when we know that people are living very close in a very small compounds and even sometimes sleeping in the same bed? So all these questions we have to ask ourselves in order to better prepare ourselves for combating pandemic. We also have to have in mind that we need a considerable bettering of our health system, and we also need to combat the extreme poverty. To me, this question of poverty must be in the center of all questioning about the measures, the social measures, even if we know that these measures have goodwill to protect people. But are they really protecting people? And I'm using the word protection in a very large sense. You can protect somebody from infecting of COVID-19, but socially what are you doing to kind of combat some phenomenon of poverty? This is why people used to say in our country that if they don't die from COVID, they will die from poverty. So this because those measures are really very restrictive, and they deal with the life conditions of the people. Thank you for listening.